techniques in therapy, and having a therapeutic relationship is common in all techniques. The other one is expectancy. Your client comes into the session expecting to change, hoping to feel different. That expectation and those hopes has a tremendous influence on the outcome of the treatment. If a client comes into your office and has no desire to change, is forced to be there, chances are their improvement might not be great as it would be if someone was highly motivated and had all these expectations. The last one, being only 15% of the reason why they found that people improve in therapy, is based on just techniques. So if you put the big four together, if you put the four common factors, you'll find that these extra therapeutic changes in the client's world, the relationship between the client and the therapist, the client's expectation and hopes, and the techniques you use will account for about the predominant reason why people change in therapy. So understanding all the therapy and the techniques are important, but as you will see, there's so much more to being a clinician. So the question being, is it the techniques or is it the common factors? So I hope you will take time to read chapters 1 through 3 and more of the Hubble book. Some of the other things we'll be talking about during the intensive weekend seminar, we'll be talking about some ethical essentials, talking about confidentiality and the importance of confidentiality. We'll be talking about multiple roles, whether you're a supervisor, whether you're in client with a coworker, whatever the different multiple roles you might find yourself in, and what are some things that we want to talk about that could possibly potentially harm clients. I think your book does a good job of giving you a history of a sexual abuse case in which the client was harmed. And I think you should read that. We will also be talking about competence, and we'll be talking about informed consent. And informed consent is just letting the client know about the ways in which you intend to work with them. So always very important. We'll be spending a lot of time with that when we see each other over the weekend. So one of the things I want you to really take away, especially from chapter 1 and as we move forward, is that I want you to really start thinking about yourself as a therapist, as a clinician, how you come to the sessions, how you think about behavior, how you think about emotions, and how you put all this together to put together a personal theory that works for you. I think about theories as a roadmap. Perhaps all these roads that we use lead to the same place, but we eventually all find the best route for ourselves. So I hope that you will use these theories as a map to get yourself to the other side. So make sure to look at some of the commentaries on 1.1, I think is the table in chapter 1. Also, the book has a great table. That's table maybe 1.1. And it gives you the summary of 12 major theoretical perspectives. I would definitely spend time looking at those 12, sort of getting just a few words that can help you describe each of those theoretical techniques and positions, because we will certainly be talking about those during the weekend. So concluding, we've just taken a quick tour of some of the major issues in counseling and psychotherapy, and sort of an inner overview of where we're going. We will certainly get much more in depth as we move forward. One of the things we'll be definitely doing is exploring each of the theories, the history, the techniques, and their effect. So please take the time to look at the critical corner section of your book. Make sure you review the key terms, and there's some wonderful review questions for you to study as well. Some of the questions that are asked during the critical corner I think are fantastic. One of them being that a lot of the theories that were developed that you're going to read about in this book were developed by privileged white and European American males. Given the narrow origins of these theories, how can the information provided be useful to you as a developing mental health professional? And I think that's a wonderful question. The next thing is Smith, Glass, and Miller did a meta-analysis, and they found that people who go to treatment, about 80% of them improve. Well, it's curious to know, why do the 20%? We know about 4 big factors why people change. Well, what's happened to the other 20%? Why are they not improving in therapy? And is there common factors in those for those reasons? And the critical corner also talks about asking you to also explore your personal theory and to come up with one that works for you as we continue to explore all the various different theories. So in reviewing some of the key terms, There's a difference between the biomedical perspective or the biological perspective of human behavior, and that's looking at someone's biological makeup. There's a psychoanalytic perspective in which we're looking at past behavior, and a cognitive behavioral perspective in which we look at the current thoughts and how that affects the behavior. Tends to be a lot more present focused. The dodo bird effect, how different techniques and different therapists all eventually possibly lead to the same outcomes. And the big takeaway message being the big four, the extra therapeutic changes that happen in a client's life that affects treatment outcome, looking at the relationship between the client and the therapist being a significant factor as to whether the treatment is effective or not, and the expectancy. What do clients expect to get out of therapy? And then eventually your techniques. So the different techniques you will use as a therapist. So I hope that you will take the time to read the required reading. I hope that you will ask questions if you have any questions. We will be doing a lot of these role playing and talking about theories during the intensive seminar. So I look forward to the next several modules. Thank you very much.